Love your skin.
Welcome to Skin School. Um, First, I wanted to ask you if you're happy that Skin School is back, that we do it every week, and what you would like to learn about. I know I have like a lot of your questions right here. Thank you for submitting all these questions. We make sure we answer them all. If not here in the chat, but maybe then our team will make sure you have all the answers to your questions. And today I'm so happy because I'm here with Jordana Brewster, one of my really dear friends. She's a fabulous actress. She lives in LA. We did COVID together-ish and did a bunch of online events together. She's always been an amazing friend and supporter, and I'm so happy I have her here, and I miss LA, and I miss you so much.
Hello, I'm so happy to be here too, albeit from a distance, but I miss having you more local as well.
I know, I miss it so much being there and like hang and have a coffee and the kids are over and playing together. It's just, like we being more than 10,000 miles apart now. So sad.
I know. But
Yeah,
it's lucky that we get this opportunity to chat.
Exactly. Your skin is glowing like always. I know you're always been like super interested in everything we're doing within Sturm and like, not just products, but also anti-inflammatory lifestyle. You've been like so good with your health as well, and always wanted to know what's the newest and what's up in the wellness and health industry. And so yeah, you've been good to yourself. I think that's sometimes hard that people are good to themselves, because
It's really hard.
Yeah, you think, that's just an example, in German you say it's gönn ich mir meine Zigarette, means like now I take a moment to enjoy my cigarette. So basic or to do something good for myself, and thinking a cigarette is a moment of now I'm enjoying and doing something good, but it's actually the opposite. You're doing something really bad for yourself. So, or having a glass of wine or a vodka or whatever, because you kind of like get so excited for this situation that you have your drink, but actually it's not really all that great for you,
But you know what I think it was about, because I used to be a smoker in my 20s, but you know what I think it actually was about smoking was you inhale.
Yeah.
And then you exhale. So I think it was actually, ironically, it was you take a moment to breathe. Yeah. When some type A people are just like always going, but it was like you give yourself a break. So now I just give myself a break without the cigarettes.
Yeah.
So I think that's the trick. That's the hack.
I smoked a little bit too when I was super young. Actually, when Charlie even was born, I feel so terrible for that actually. But you're right. And then you see that you're breathing because you're breathing out this stupid smoke. And then I stopped and I smoked cigars for a second, and then I got yeah. I loved smoking cigar. Not like a whole cigar, but like, a bunch
but cigars you're not supposed to inhale, right? You're supposed to just...
you don't inhale. But still, it kind of affected my stomach. And I think I got gastritis from it. And I didn't smoke every day. I smoked like, when I went out maybe every 2 weeks or something, but it's so strong. I was never a heavy smoker. Anyway, that's so bad for us. I mean, like,
it's so bad.
So yeah, today people are vaping, but it's probably not even better. So being good to ourselves, meaning like, take care of your organs, taking care of everything which needs to function. Yesterday, for example, I ruptured my muscle by playing paddle tennis, and the reason why I did that, because you don't stretch before you do your sports. Why don't we take these 5 minutes to stretch before doing it's meant to we have to be good to ourselves and think about what we do to our bodies. No,
yeah, it's true. I really love paddle tennis too, and it's super fun, and it's such a rage now in the States. But it's true for me. I end up like walking around like this because I'm always using the right side of my body, and then all of a sudden I'm like, oh no, I need to
And it's
relax,
stop and
you know?
go. It's stop and go, and you have to do like fast movements in all kinds of direction. I don't know what we're talking about paddle tennis. I want to talk about skin and health and
Because we're talking about self-care
yeah.
yeah.
But with you, I actually also want to talk about Botox and fillers, and we talk all
Yeah.
about skin too. But um, there are questions here which say, do you recommend using Botox fillers or creams enough? And I always say it's a combination of things, and it really also depends of your genetics. If you're very heavy in your mimic, that you use your facial muscles a lot when you talk,
Right.
then your frown lines get worse faster, or your wrinkles around the eyes, the fine lines. The fine lines are anyway the first little bit, because the skin is very thin and the microfacial circulation is lower. So this
Right
part
here.
is the first signs of aging, really. And then obviously, our muscles, our mimic muscles with age get stronger, and they bring us even more in like conflict in doing these like crazy, sagginess motions or frowning motions. And so I find Botox for these areas quite interesting and super helpful, while
Mm-hmm.
you feel better looking in the mirror, you feel better just like in your own skin by using these like little tools to relax the muscles, which put you in a more depressed situation. And that's why I'm a big fan of Botox and fillers used in the right way. It's always
Yeah.
the
I
way.
think it's
Yeah.
I think it's especially important when like we're doing what we're doing now, where we have to, I mean, I'm looking at you, choosing to look at you, because if I start looking at myself, I'm like, oh no, like, look, what about this? What about this? But, and especially as an actor, when you have to put yourself on tape and then watching the tape back, you're going, oh my gosh, why is that uneven? Or why do I have this? And you're just so much more aware of how you look. And I think a lot of people during the pandemic and doing Zoom, they became so much more aware of their physical appearance. So you almost can't help but use those tools when they're available to you. And they are super useful, I think.
But that is also, as an actor, you have like, almost a responsibility, because it's your capital, it's your career. You are almost responsible to make sure your skin is always perfect. You know, you represent a certain type, and you get booked for this certain type, so you better don't age that fast. I mean, like, there are so many things you have to take care of, and that was always one of the interesting aspects for me going to Hollywood, because whatever I brought there was very well received. And with the blood facial 20 years ago, when I brought the idea that you take the blood and you process it in a certain way and create these anti-inflammatory proteins to re-inject into your skin, that was very, very new when I came there like 20 years ago. And that
How
you
did
know,
you
everybody,
discover
huh?
that again? Do you mind telling me how
Yeah.
you discovered that again? Because I mean, that was revolutionary.
Yeah. So 20 years ago, I was working in the orthopedics, and I helped pioneering this treatment where you take the patient's blood, create these anti-inflammatory proteins, and re-inject those into the joints to bring down inflammation and stop the ongoing aging process. So inflammation and aging goes very, very close together. And then I translated the knowledge from the orthopedics into the skin, and then I started treating patients with your anti-inflammatory proteins, in the skin. And in the beginning, I mixed the hyaluronic acid together with the proteins from the blood, and I mixed it together, and I would inject half the face of a patient with that and the other half just with hyaluronic acid. And the results were so much better if you used your own healing proteins, if you really did something on a molecular level for the
Mhm.
skin as a rejuvenation, bringing growth factors in. That's another point. When we age, we deplete ourselves from healing factors too, because when we get hurt or something, if you cut your finger when you're a kid, bam, it's gone. It's healed.
I know, like
But if you do it now, it takes a little longer. So every healing process takes longer when you age. So introducing healing factors back into your system, whether it's skin or joints or whatever it is, I think is very essential for an anti-aging process. And, I don't know, do you have the exosomatic line? The black?
No.
Oh my God,
Mm-mm.
I have to give them to you. They're amazing. That's the exosomes, which basically the exosomatic represents exosomes and growth factors. So healing factors get reinfused into the skin to actually bring those, anti-inflammatory components into the skin, but also help with cell repair, with rejuvenation, with rebuilding collagen, elastin, you know, making sure the cells are okay, they're ready to divide and being healthy to new cells. So they're very, very good healing factors. And this is when I always talk about, lots of people like to use retinol or
Yeah.
glycolate. It's like very abrasive, or acid peels for that matter, and these acid peels or retinol not only causes inflammation, which makes us age, but also destroys the skin barrier, the microbiome, and basically forces your body to bring a lot of healing factors into your skin. And you don't have unlimited healing support all the time. So
Right.
I think, the idea of damaging yourself, and this is when we come back to being good to yourself. Let's think about, in what way do we like to damage ourselves? Okay, if we miss out on an hour's sleep or 2 hours sleep once in a while, we can handle it. Or we have fast food and eat McDonald's instead of, something healthy or whatever. But if you
Too many
constantly,
glasses of wine.
yeah, exactly, a glass of
Yeah.
wine. It's also, we need it for our happiness, whatever, and it's, social behavior. But if you destroy your skin on a daily basis, it's really like something you in the long run will get a lot of problems from it. So I personally am not like a big fan of this anti-aging approach.
That makes me think of those, because there was a time before I met you where I was doing those treatments where you literally damage your skin by pricking it with needles, and it goes really deep. And I remember doing a treatment once where I pricked my skin and they were like, you're going to be red for 3 weeks. And then I went on a ski trip. So then I exposed my skin to like,
Done.
I was practically frostbitten, and I thought it was going to induce like collagen renewal. But now that you say this, it doesn't make any sense that I was doing that.
So it depends. You can do a very soft microneedling, but you do a very, very short needles. You should never bleed, and you can
Right.
enhance your collagen stimulation, but you don't do this on a daily basis. You do this like,
Right.
once every 3 months, whatever. So your skin heals and the inflammation level is very, very low, especially when you do it together with a hyaluronic serum or an exosomatic. So you can do very, very mild microneedling. But if you do this like super abrasive,
Yeah.
you're bleeding. And then what's happening with, by the way, you destroy your skin barrier. That's what you said, you had frostbites or whatever, you went on a ski trip. But not only that,
Mhm.
very, very close to the sun. So the sun basically hits your skin as well. And what's happening is you get pigmentation issues from it, because the sun burns through your skin, because you kind of create like this entrance to the skin. And that causes post-inflammatory hyperpigmentation.
And that's an issue with me because of my skin tone. Like if I get a zit or like it stays for months. It's not
Do you
something
take
that
the
just
darker
like,
skin tone line? Are you using the darker skin tone line?
I do, yeah.
Yeah.
And it's helpful. But the clarifying skin tone line is what's helped me the most since I've been
Yeah.
breaking out. It's helped a lot because again, a zit lasts like a couple of months. I'm like, I can attempt to pop it or get rid of it, but then it's that mark is still there for a little bit.
But you see, when you it's like your skin tone is prone to, every skin tone is prone to post-inflammatory hyperpigmentation. But if you have like a little more fair skin, you get red dots.
Right.
My daughter Charlie gets like these red dots when she's like popping a pimple or something. But the darker your skin tone is, the darker your spots get, and like the pigmentation is way bigger because the inflammation level is bigger, because the melanin in the skin causes higher form of inflammation. So the darker your skin is, the more you're prone to inflammation, and that's why you are more prone to post-inflammatory hyperpigmentation. And then that's good for the darker skin tone line. And you were just saying you also have little hormonal breakouts right now, and switch to the clarifying line. And that's a really great combination, a darker skin tone line with the clarifying line together for breakouts.
And should I do that? So, okay, so I'm 43 and I think I mean, let's say kind of entering perimenopause. And so I have these hormonal breakouts that remind me of when I was like 13. And right before my period, skin feels more sensitive. I break out here. I'll break out around my chin area, which I think is normal. But then should I use the clarifying line throughout the month, or should I mix it with the one you said, the darker skin tone line? Like, how should I mix and match?
So the darker skin tone line you use throughout the year, because what the darker skin tone line is doing, it's like extra anti-inflammatory, extra antibacterial, and it evens out the skin tone. So no matter what, use the products from the darker skin tone line. And then the clarifying product, like the cream or the clarifying face mask, you use throughout the days where you have like the extra needs, and you want to control your sebum production, you want to heal up the spots, get rid of redness and all kinds of things. This is where the clarifying line can be used additionally. And I personally think, in LA, you have like drier skin. I always feel there, my skin is especially dry. So I think when you then, when you're out of the few days where you tend to break out, you can switch the clarifying line against the super anti-aging or against the normal face cream or something. You can switch it up depending on what days in the month it is.
Right. It also depends on water, right? Because, for example, in LA, I was using the ski cream a lot, and I was just like sloshing it on my skin. And then here the water is a lot more soft. I'm out in Santa Barbara, and it feels like I need to switch it. So I've been doing clarifying or more mild moisturizer because I don't need something so dense.
You know what also helped me a lot in LA? When there were the wildfires and there was a lot of pollution in LA and dryness, what I always used a lot was the anti-pollution drops. I put the anti-pollution drops on top, and the anti-pollution drops would lock the hydration in. And hydration is one of the most important components when it comes to skin. So if you have dry skin, that's never an option. Dry skin we need to fix, then come to Mama Sturm, I fix it. Dry skin is never an option. So even when you have like breakouts, whatever, sometimes products would suggest you need to dry out your skin. And that's what happens a lot with, for example, retinol, that you get dry, sensitive skin. You cannot dry out your skin. And especially also when you have breakouts, you always need to hydrate your skin. And sometimes when you have breakouts and cystic acne over a long time, like a couple of weeks, then you have like Retin-A, for example, as an ointment, or sometimes you need to take Accutane coming from a dermatologist. So you use it as a treatment over like a short period of time until your breakouts are cleared up. And then you go back on your normal situation, but don't use retinol for anti-aging purposes. And if you use it, always make sure that you have a hydrating skincare routine first. So always do your really good skincare routine and then add your ointments or treatments from your doctor, whatever you need here.
Right. That's a really, really good note. What if you have allergies and you're taking, like, sometimes I have to take Claritin D and I completely get dried out. And I feel like no matter how much water I'm drinking, I'm still dry and my skin feels dry. And then I use the glow drops. I use the calming serum. And sometimes I can put it in my car and have it by my glove box. And I need to sort of like spritz my face because you're combating something that your body's doing. You know what I mean? You have to sort of it's hard to keep the hydration in. What do you recommend then?
So did you try the face mask?
I love, I have to admit, my wand was dirty because I have been using the face mask a lot more. Yes. It's
So
super helpful.
that that what I'm in the mountains right now, and that also dries out your skin quite a bit. So I almost every morning put on my face mask and just hydrate right away. And what I also would try the anti-pollution drops, because I feel like that
Okay.
really locks your hydration in. Another product, you probably have it, the night cream. You have the night cream.
Yes, I love the night, and I have the night serum as well. I love the night serum.
Perfect combination. So with the night cream, what I love about the night cream is that, we use that ingredient polyglutamic acid, which is 4 times more hydrating than hyaluronic acid. The thing is,
Whoa.
and it only sits on top. It doesn't go deep, but it sits on top. And what it does, because throughout the night our skin becomes more permeable, and then we have more transepidermal water loss, which is so bad because it dries out your skin, and then we get like wrinkles and whatever we don't want. So this night cream seals in the hydration, locks it in, and doesn't have the transepidermal water loss. You know, that is something, especially when we age, because when we age, we already have transepidermal water loss, because of, how our skin becomes just more indented and, all over the place. That's why it's so important that we
Oh,
always
it feels
hydrate.
so bad.
Yeah, but that's why it's so important we always hydrate. Have a hyaluronic serum all the time, all the time. Hyaluronic serum every morning, every night. Hydrate, hydrate, hydrate.
And please stress, because I always thought hyaluronic was acidic, but it's not. It's not, because I
Because
can't
it's
do
called
anything.
acid. Yeah, it's an
Yeah.
acid from the chemical formulation, but it's just basically a water gel. We have it in our skin, we have it in our eyeballs, in our joints. We have hyaluronic acid, and it's something we should have on a daily basis, twice a day, morning and night. And the molecules, the water molecules, they basically separate. They help to promote our ATP production and help to give the cells also energy and power. So the cells are better in bringing the waste away, taking on nutrients, having a better metabolism. So for our cell metabolism, it's really, really good to have this hydrator hyaluronic acid.
What's
It's
ATP?
it's the ATPs are energy, our fuel.
Oh,
The fuel.
cool.
It's like the gas for the car. It's our fuel, and we run on ATP. And this helps to produce ATP, but also it's just a super cool carrier for active ingredients. So hyaluronic acid really penetrates into deeper layers into the skin, and you can take active ingredients like our telomerase activator into deeper layers of your skin, which are highly anti-aging ingredients. But I tell you, it's so important to hydrate your skin. I can't, people say, oh yeah, it's so, it's like, oh, it's just hydrating. Hydration is, I cracked the code for hydration. Hydration is the most important thing, because it also stabilizes our skin barrier. And our skin barrier needs to be flawless. Yeah. And if our skin is healthy and hydrated, we get the glow.
Mm-hmm. Which I can see right now on you, Dr.
I
Sturm.
see it
But
on you. I see it on
question, this is the first time I've seen the super anti-aging eye serum. How do I use it? I'm super excited about it.
Look, look, I have
Oh,
it.
no way.
I have it. I don't know when it launches. I think it launches like any minute. So, oh, that's so interesting, by the way. Around the eye area, every problem we have with our eyes, whether it's dark circles, puffiness, fine lines, is going together with problems in microcirculation. And on top of it, the skin is super thin, and you see everything through. So if we have a circulation problem, our blood becomes to stop. It's like a stasis, and then the blood diffuses into the area. Then you become puffy eyes, and then you stretches your skin that you get bags, and the dark circles is because if the microcirculation goes down, you don't have oxygenated blood, and
Mhm.
then it appears darker and you see it through shimmering, you know. So all goes to
Yeah.
with microcirculation problems. That's why the ATP production is so important. You know, there are active ingredients like red algae, calanthe, um, uh, polysaccharides from the baker's yeast. There are some really cool ingredients which help to promote the metabolism of the cell, help to promote your ATP production, help the microcirculation. So that's why the serum is so necessary, especially for those problems. But how to use it? So I tell you how I use it. What I always do, I use my hyaluronic serum all over my face, and I always include also my eyes. So I always use that also over my eyes. So I double up. Then I take a little bit of the eye serum, um, just like a drop. You know, it takes you a long way, by the way, this eye serum, you know. So, and then you just pat it around the eye area. And what I put on top is the exosomatic eye serum. So we also have an eye serum from the exosomatic, and it's the same like with you know, the rest of our face with the skin, you can layer those serums, you know. And we did it like
Mhm.
before and after with this
Feels
eye,
really good.
which is amazing, by the way. If you use it, if you get the eye serum, all of you, take a picture before and then use it for 2 weeks and then take another picture, you freak out. So we did it with a bunch of our team and we got the most amazing results with it.
And you really have to protect this area, because can I tell you something that happened to me that I think people in LA are the ones that notice this, because we're driving so much and we look
Yeah.
in the rearview mirror and we're
Yeah.
like, so I got Botox here.
Yeah.
And then all that happened was the wrinkles went here.
Oh,
They migrated.
oh, no, no, no. You know what? You know what? That is so interesting that you're saying that, because when it comes to this area, you're absolutely right. If you block this area for the fine lines and then you smile, you got it all here under the eyes. Yeah.
It looks so
So
weird.
yeah, yeah, no, it's really bad. And that's why when you go to a doctor, they only can inject Botox very superficially around the eye areas, that you don't
Yeah.
address the whole muscle, but really just the skin on top. And it makes a
Yeah.
difference. And you just should do small dosages. Because otherwise you look weird.
Yeah.
I had that for myself when Charlie, my oldest daughter, was a little younger. I mean, she went to school, and a friend of mine who's a doctor as well, she injected my entire face with Botox and a lot. And I had that and I couldn't laugh anymore. And Charlie said, Mommy, when you bring me to school, don't get out of the car. Just let me smile.
Oh no.
Yeah, it looks so freaking weird.
That's crazy.
Yeah.
Yeah. No, can I tell you something I noticed about that? So I put the eye serum on my hand right here
Yes.
before I put it on my eye. And this part of my skin is so much smoother, and it's like the crinkles have disappeared.
So nice. So it's so nice. Also, the serum
Oh my
has a bunch
God.
of hydrators in there, like a
Yeah.
lot. Beta-ine, gluconolactone. You know, I'm sometimes I forget my own ingredients, and panthenol. Like we have beautiful ingredients just to push glycerine to push hydration into the skin. Besides all those active ingredients, you know. Um, it's fantastic. It's a super cool formulation. And I actually, you know, when we tested the eye serum, I started just using it all over my face. It was so good.
No, it's really, it's delicious. I love it.
Yeah. And it's a little smaller bottle. You see, it's like only 20. So you see the hyaluronic is a little bigger. And that's the new eye serum. And by the way, Jordana, do you have the makeup remover?
I just got
You
it.
just got it? Oh my
I'm
God.
super excited.
You will freak out. This product, and I never thought I would ever use a makeup remover because I never really use it. But then Pepper forces me to put mascara on sometimes, so I am using it, and I really love it. It's so nice, so great for
I'm
your skin.
so embarrassed. I used to use baby oil. to remove
But that's
my
better than
makeup.
a stupid eye makeup remover, which has bad ingredients. Better to use baby oil, you know?
Is it? Because
Yeah,
conventional eye makeup remover has just tons of
yeah, bad ingredient. Not
icky
this one.
stuff.
Not this one. This is micelle technology. It has hyaluronic acid prebiotics. It's beautiful to a water phase, or oil phase, only um how do you call it? Plant oils. Beautiful, beautiful combination.
Oh, I can't
So
wait.
and use it. But you know when Pepper is putting makeup on, before I had this eye makeup remover, what I would do, I wouldn't wash her face with the cleansers, but I would just put some cream on a cotton pad and would take it off, you know? So you can
Mhm.
use oil or creams to take off makeup. And sometimes I was doing that, you know?
Yeah, which is, I mean, yeah, I can't wait to try it. Excellent. But I think baby oil once you get older is not the best idea for me.
No,
So I'm
also,
glad I have an alternative.
yeah, no, you will love it. Also looks good in the bathroom. So what's your skincare routine now? So what are the products you are using? What is your
So
favorite?
so right now in the morning, I love, I love the balancing toner because it makes me feel like refreshed. So I wash my face. I have the balancing toner. And then I like mixing it up sometimes. Right now, you can see I've been using the clarifying serum a
Yes,
lot. But as we go into the fall, I suspect that I'm going to use the calming serum a little bit more because it's getting, which is right here, which is it's just getting a little more dry. So I think I'm
yes,
gonna pivot to the calming
good
serum.
choice. Good choice.
And then I love the rich face cream. So I pivot between the rich face cream and the clarifying face cream.
Very
And I feel like I'm in a test.
oh.
And then the night
No,
serum at
you're
night.
total professional.
And then the night serum at night. Um, and definitely the anti-aging eye serum now. I'm super excited to try that. Super excited.
But it's a good point that you say, when you switch from summer to winter, when it
Mhm.
becomes, colder and you have the heating system on and, the skin becomes more dry to introduce more lipids to your skin. So the calming serum is actually a fantastic product to add to your skincare routine because it not just only takes out redness, but also gives you extra lipids, soothes your skin, takes irritation, inflammation out. It's a beautiful healing serum. And also switching to the face cream rich is a beautiful choice for the winter months,
Yeah, I love like keeping the moisture in and the feeling of that. It feels really, really good.
Very good. So what do you do in Montecito? What sports do you do? What do you do? Do you do meditation, yoga? Is there any ritual you do
The
to and
ritual is, well, my way of keeping sane is to I get up at around 5 or 5:30 every morning and I run.
super
That's
cool?
that's the way I stay sane. And then this morning, my son, my 10-year-old was up, but he had his reading to do for school. So I said, okay, buddy, you're gonna read while I'm on the treadmill and no TV till that happens. So I think self-care is really important because if you don't feel sane and you don't feel okay, you're then also not going to be okay to everyone else that you have to be there for. So I think it's super, super important. And I think it's really important to check in with yourself and make sure, like, where's my nervous system at? Like, am I being reactive or am I coming from a place of calm and certainty versus just like rushing to fix things? Because when
Yeah,
I'm in that fight or flight mode, I'm no good to anyone. And I think a lot of us feel like we have to, do things immediately when really we don't. We have to like stop, think, and then do.
it's very good advice. I will think about it too. I have those situations too. One question, if you get up so early in the morning, I love that. That isn't this the perfect time to go out and get some sunlight and oxygen? Do you also run outside or just inside?
No, I run inside because I think my boys would freak out if I was not home.
I,
But I do love the sun. And that's what I love about you too, is you never said to me, you cannot get sun and you cannot go to the beach and you cannot live your life, because I think a lot of people are like, and I see people on the beach wearing gloves and long sleeves and hats. And I'm like, that's not a way to live your life, you know?
But these are the people who also use retinol and do laser treatments and all this kind of stuff. And if you damage your skin to the grounds, where of course sun will damage you even further. That's why it's so important that we, support our skin barrier, protect our skin, make our skin strong, keep our skin in the best shape. So when you go out, obviously you wear sunscreen, and you don't have to wear sunscreen early in the morning. That light doesn't have UVA, UVB. If you go out really early, you get the really good light, because we need to produce vitamin D. It's so important, the sun, for our respiratory tract, for our mental health, for our mind, and for our bones, for our hormones, for everything. I mean, like sun, every cell in our in our system has receptors for vitamin D, and vitamin D gets produced by the sun and by cholesterol. So this is the only vitamin which gets produced actually in our bodies, and we need the sunlight for it. It's just so important, and that's why this, I'd rather stay super healthy, get some sun intake, because it really supports my immune system as well. And then obviously, I'm close to the mountains. You are in a, desert. Like the sun is obviously quite brutal. So we need to cover ourselves with sunscreen, when we go out at a certain time of the day and, do a hike or tennis or whatever it is. So it's important to protect, but obviously don't hide from the sun.
How often do we have to reapply the sunscreen though? Because I think for me, it's one and done, to be completely honest, which I know is not enough.
No, but that's what I do. If I don't do it early in the morning, I do it later when I go out. But then, it depends. If I play tennis and I sweat, yeah, then you need to wash your face and take a shower, whatever, and you reapply. But or if you go in the pool or if you go in the ocean, you reapply. But if you're like, ready for the day and there's not much going on, you're good. It's a long-term protected. At least my sunscreens, they're like for long term.
Okay, good. Then I'm doing it right. Excellent.
Yeah, you're doing it right, and you look very glowy.
Thank you.
Does anybody want to dial in, by the way, guys?
Yeah, we do actually have a few people. Stephanie is on the line. Stephanie, if you want to just turn on your camera and ask your question.
Hi.
Hello.
Hi.
My name's Stephanie. I live in South Dakota, and I'm 52, and I currently use the super anti-aging, the day cream, the evening cream, the serum, and the eye cream. And winters here are very brutal. We have terrible wind and forced air heat, so it's incredibly dry.
Yeah.
And so I was just wondering if there was something I could add to, or actually change in my daily routine, because I must admit, while I use all of those, I'm not one for any more complication.
Yeah.
Yeah, no layering of serums. It's just kind of like one serum, one cream.
Yes. I get it. I hear you. You want it simple but effective. Tell me, that is probably the stupidest question you have heard. Did you just said heat and winds? It's not getting cold there, right?
No, but in the summer, it can, basically, I like to mention that the temperature here goes from 40 to minus 40.
So it is cold.
I mean,
it can
40,
be cold.
40 Celsius.
Celsius.
So,
Okay.
yep, the metric, yeah, I go from 40 to 40, minus 40. So,
okay, so you have
I run the gamut here.
Yeah, I love one serum to really also take it seriously with the irritation on the skin, redness, and winds, whatever forces from nature come towards us. The calming serum is so great because it not just only introduces like lipids, but also has so many amazing ingredients. It's like a house pharmacy, which heals, take inflammation out, takes redness out. It's like, it works for everything, for, winds and all of that, but also from, mosquito bites or after shaving or whatever, house pharmacy kind of material. So the calming serum would be one serum you could add when it's it's brutal winds and stuff. That's one idea. The other idea, I'm obsessed with the anti-pollution drops because it kind of creates a shield on your skin and blocks everything out, but locks the hydration in. That would be another alternative, I would think, could be very, very beneficial, and especially in these extreme weathers. I made like amazing experience with the anti-pollution drops. And if you're looking for more hydration or after weather experience at home, maybe the aloe vera face mask soothes your skin after whatever is happening and rehydrates, soothes and takes inflammation out, and it's just like such a great healing product as well.
All right.
I mean, we have so many options and choices. I made a lot of products.
I was wondering if there was kind of a time or context when the exosomatic, I'm sorry,
Yeah.
I stumbled over it, when I would essentially graduate up to that.
So the exosomatic is like, for me, 15 years ago, I worked with exosomes in the orthopedics, and it was already very fascinating. And I just told you guys that I invented the vampire facial, the blood facial, the PRP. And at the time, I was working with professors from Pittsburgh and Harvard. And Professor Paul Robbins from Pittsburgh said that at the time, we need to look at exosomes. Exosomes, everything you do, you should do with exosomes. And it stuck in my head, and I was trying, I know how to extract exosomes from your blood cells, but I didn't know how to do it in a, mass product, whatever. And what we did in the orthopedics, we used exosomes from the patient's blood, and we injected it in patients with rheumatoid arthritis. And, whoever knows people who have rheumatoid arthritis is very painful. Lots of joints are a problem, and it's an autoimmune disease. And we injected a few joints with the exosomes, and the patients were pain-free for 3 months in their entire body. So exosomes are some really powerful healing tools. And my brother, for example, has rheumatoid arthritis, and I gave him last winter season an IV drip with exosomes. He didn't have any symptoms throughout the entire winter. Normally in the cold, it gets worse. So for me, exosomes are future in longevity, but also in skin. So if whatever we want to do on the anti-aging level, use the exosomatic. It helps with cell repair. It is a shortcut to healthy cell replication. It takes inflammation out. It's just like a tool for everything, like a healing tool. It's just to rebuild collagen, to upgrade your skin, restructure your skin. So whoever thinks, shit, I'm aging, that's when you use the exosomatic as a, I think it's the newest big thing. Not just in skin, but also longevity. Yeah.
All right. Thank you very much.
So nice to meet you, and hopefully see you soon. If you have any questions, that's another thing. I have the most amazing I won't say customer service team, but like, a support team. These people working day and night. They're so knowledgeable. They're amazing. They love what they do, and whatever anybody ever needs, they're there, and they're ready to help, and we'll find a solution to whatever you might seek advice for. Okay.
Thank you.
Bye.
Okay, next we have Rachel online. Rachel, if you want to just unmute yourself, there you go.
Hello, how are
Hi.
you?
Good. How are you?
Great. My name is Rachel. I live in Manhattan, New York, and I actually met you, I don't know if you remember, at Bergdorf for the exosometric
The talk
launch.
with yeah. That was a nice event.
That was
Yeah.
wonderful.
I'm
And then
coming back to Bergdorf's. Did you get an invitation?
I
When
actually
on
might need to check my email. Was it through Bergdorf or was it through your
Bergdorf?
company?
We're
I'll
coming
reach
end
out
of the
to my-
month. End of September, I will have
Perfect.
a talk at Bergdorf's with Dr. Wilco. So it's going to be very interesting.
It's on the 26th of September, FYI.
Amazing. I'll reach out and see if there's room available.
Yes, come.
That would be great. So you spoke a lot about skincare, lifestyle, some important highlights about like health in general and being a woman. I would like to learn a little bit more about your V wash and V drops.
Good.
So I'd like to know why you created these products and if you feel there's a rising importance to start focusing on feminine health.
Yeah.
And if so, why is that?
You know, it's a very good question. I'm glad you're saying this because, you know, with Sturm, I'm making so many products and I cannot possibly talk about all the products all the time, although I want to. So I'm really glad you're asking this question. So when we look at our skin, you know, and when we look at our entire body, you know, we don't only have skin on our face. You know, we also have skin, you know, on our arms, on our armpits, you know, our genitals, and every area, our scalp, you know, every area needs certain attention, you know, and whatever we do to our body. And, you know, the most brutal thing is actually the scalp, what we do to our scalp with all these like crazy ingredients and shampoos and conditioner, kills hair follicles, kills our, you know, health of our scalp, and therefore has some implications when it comes to hair growth, to, you know, quality of hair. So, you know, we need to pay attention to each area of our body. And when it comes to our genitals, you know, if we would, you know, skin in general is slightly acidic, yeah. And if we would use soap or shower gel, whatever, it's very alkaline. So our genitals live off a very, very, very acidic pH because we have bacteria, lactobacillus, which need to have this very acidic pH to ensure they're okay. And this is what prevents us from getting candida, from getting UTIs, from giving our genitals a very, very healthy flora of, you know, prevents from dryness. That is also important for the menopause, by the way. Yeah. So this microbiome in this area is so important and it needs to stay acidic. So if we now use like washing ingredients, which messes up our pH, then we have a problem. So lots of women actually have dryness, they have UTIs, they have candida, they have all these problems, and it can be easily fixed. And there is another question, to focus on this area. There are lots of these products which actually are very heavily fragranced, which is very, very dangerous because it also messes up the microbiome and kills our microbiome. So don't use fragrance in your products, nothing which touches your skin. And I know it's very tempting. You want a shower gel which smells. Meanwhile, I'm so the opposite. I have a shower gel that doesn't smell. And if I now am somewhere where I don't have my own shower gel, I'm like, oh, I can't have these fragrance products anymore. I think it's just the way you used to. You know, also skincare products, if you smell a cream with fragrance, say, oh, I can't. You know, if I want to use a fragrance, I buy a fragrance I like, but not use a fragrance, you know, some skincare company is putting in the cream. So I, you know, then I rather make my own choices of what fragrance we like. But, you know, fragrances shouldn't have a place in skincare products or shower gel or shampoos because it destructs your skin barrier.
I will say I really appreciate that about your line and all your products. But surprisingly, your laundry detergent smells very good.
It smells so good. Can you imagine there's no fragrance in? Can you imagine? I was like, when I got the samples, I'm like, oh, it smells so good. And then I was like,
So
okay,
good.
some washing with it, and let's see. It's so freaking good. It's so good. And you know, it has aloe vera, persimmon, skullcap. It has the most amazing ingredients. You're using it.
Yes.
And you need very little. You need very little. You don't need all the stuff. I know.
Yeah, it's great. And I like the packaging. Everything about it's wonderful.
Oh, I'm so glad you're using it. That was just like a, you know, I want a detergent. Let's do it. It's like, you know, it's not a product we're just like exploding on the market, because obviously I don't have shelf space at Whole Food or something, but it's such a great product.
It's brilliant. Well, thank you so much. I look forward to seeing you in a few weeks.
Yes, come. Looking forward to seeing you. Bye.
Okay, so we've just got under 10 minutes left. We're actually getting lots of questions through based around rosacea. So Nico wants to know if you have any anti-rosacea remedies, if we've got any good cooling creams for red and pink undertones, and what's a good rosacea skincare routine.
Look, it's very interesting, actually. I know, you know, rosacea is a very common skin concern, but in general, sensitivity, dryness, redness in our skin is mostly caused by the products we use on our skin, and especially aggressive ingredients like retinol, for example. They can cause all of those issues, you know, and they can make rosacea worse. And so with rosacea, we have a whole routine put together, which is our cleanser for every day, the enzyme cleanser you use twice a week, very gentle form of exfoliation, or you just only use it once a week. And then you use your hyaluronic serum, the calming serum, and the face cream light. That's your rosacea routine. And the calming serum is so fantastic because it will take the redness down. It's such a beautiful product, and it's a super good rosacea product. So I want you to try that. Interestingly, also what Jordana is using, the clarifying serum, also fantastic for rosacea. You could even do, instead of the hyaluronic serum, you use the clarifying serum, then the calming serum, and then the face cream light. So that is a beautiful routine for rosacea. But coming back to sensitivity and redness and pink undertone, if you use aggressive ingredients like glycolic, retinol, retin-A, acid peels, like very aggressive, or for instance, like fragrances in products or mineral oils, or a lot of alcohol in your products, that can cause those issues. And then it makes sense. And maybe you say, you know what, I don't care about the inflammation. I want to use retinol because I like it. Then I would recommend, if you use all these things, use the calming serum, but also the exosomatic, because these serums help to heal the skin, you know, because you have to heal your skin. You have to constantly heal your skin if you damage it constantly. And, you know, your skin gets damaged anyway already by pollution, by, you know, particulate matter, by anything around us, stress. Our skin already gets bombarded, you know, by whatever we are living in. But introduce healing factors. And Jordana, I will send you the exosomatic, because you have to have it. Chloe, we need to send the exosomatic. Nobody gets it, by the way, because we're so low in stock. Jordana, we're not gifting this to anybody, only to you.
Oh, thank you. Thank you. I have a question, because my husband, when you were talking about rosacea,
Yeah.
I was thinking about Mason, but then he has a beard. Okay. So
Yeah.
how, like, it sounds so weird, but when, like, if I'm putting the calming serum on him, how do you get the product under the beard?
By the way, guys with beard, they love the scalp serum. They use the scalp serum on their beard, and they love it. Try that.
Okay, cool.
And the calming serum, you pet on around, you know, and then you try the scalp serum, because it's like a hyaluronic acid base. It's easier to apply with the pipette. But it's a good point, you know, men and women, they should all use Sturm, you know. It's like, it's this unisex skincare line, you know.
Well, kids too, because my son, I keep mentioning my 10-year-old, poor Julian, but I went to kiss him today, and his scalp was like so perfumed, because he got I'm not going to mention the product because I don't want to sell anyone out, but it was so strong. And I was like, Juju, what did you wash your hair with yesterday? And he mentioned it, and because he wanted to be manly. And I was like, I'm taking that away, my love. It has so many chemicals. So I also need to get like the.
But you know,
the
that's the
shampoo
thing,
because
you know, especially the kids, they love it. My
I love
Pepper, it's like Pepper, you know, this smells so good. And like, oh my
Yeah.
God, like, you know, obsessed with like other skincare brands because there's like a smell in it, you know, and I keep explaining. And now she,
Yeah.
you know, with her friends, they were in the bathtub and they were washing their bellies with our shower gel. And she's like, oh, Mama, this shower gel is so amazing. It leaves your belly so soft. So, you know, you have to always tell them this is the reason
Yeah.
why this is not good. And, you know, now Pepper, when she's at a friend's house, she always asks me, can I use this on my face? Can I try this? Can I whatever? You know, it's like she gets it, you know, and you cannot stop educating the kids for it because, you know, they would get problems with their scalp. They would get dryness. They would get dandruff. They would, you know, Chloe's going to send you like the big hair care packs for the shower.
Thank you.
So
Yeah, because that's just a load of chemicals that no good.
all you need in the bathroom coming from me.
You should see this. Look at this setup. It's pretty stunning.
Oh, and look how good it looks. Look how good it looks.
It does. It looks very beautiful.
I love it. I love it. That's amazing. Shivi, what's going on? Do we have someone else to dial in? Any more questions? I have like all these questions here and I don't have glasses on. Do you need reading glasses, by the way?
I need it for driving.
Oh yeah, but I can't read anything anymore. It's just a joke. It's like
No fun.
no fun. But I tell you, you go in a restaurant and you're just like, oh, I forgot my glasses. And you just ask, what's the fish of the day?
You lose your glasses about 5 times a day. I do remember that from you. But really, really quickly, we've got 2 minutes left. We've got one final really good question. A lady who has just had a baby, she's suffering dry skin from pregnancy. Is there anything that you would recommend? And are there any products she should avoid after having a baby? 2 minutes. Give her your rule.
Yeah, obviously we're so sensitive when it comes to, you know, having a newborn, and you want to make sure, and you breastfeed, you want to make sure you're having the right products to soothe your skin, to give enough hydration. I, for example, had super dry skin after my kid was born, after Pepper was born, and that's, you know, coming together with the hormonal changes. Some people have extremely breakouts when hormones changes, or melasma, you know, pigmentation issues. So but I always think, you know, first of all, for your belly, use our body cream. It's mind-blowing the results we have with it. And then you can keep it very simple. I have a hyaluronic serum and our face cream. That could be it. That's, by the way, for everybody, not just, you know, pregnant women or women or men, or, you know, women who had a baby, but also for men, women, everybody. Your routine could be as simple as these 2 products. A hyaluronic serum and a face cream, but you've got to have it, and you should only use Sturm. If you have these 2 products, you will have a really great skin barrier function. You will have healthy skin. You will have hydrated skin. You will have a balanced skin. So you will have all the benefits you can get from Sturm. I promise you that. So you don't need to have like a whole big situation. But if you have melasma from pregnancy, add the beta B, the niacinamide, because it evens out your skin tone, and it's also a super hydrating product, makes your pores smaller, beautiful serum, also great for hydration, extra hydration, is the calming serum, or also our vitamin C, the good C. I mean, you can use the entire line. There's nothing, you know, which could disturb your, you know, whatever, you know, it's all healthy, it's all clean, it's all suitable for and you should have the baby and kids line for your baby. I created this for Pepper, and it's just, these are the best products. I had a husband from a patient I saw in Düsseldorf. He said to me, you know what? Your nappy cream is the best nappy cream on this planet. And he's right. Our nappy cream is so sensational. So for every mother with little kids or babies out there, tried the baby and kids line. They're amazing. Did you have this for your kids, Jordana? The baby and kids line?
I do. I have a funny story about the nappy cream too, because I was using the kids cream because it's very dense and I love it. I was using it in LA, but one day the nappy cream was on my vanity. And then I put nap and I was like, oh my God, I put it all over my face. But I did.
Fantastic. I love it.
It once went on my face.
Oh, it's awesome. It's awesome. I would like to take it I would have loved to see a picture of that. Anyway, I'm so happy I got to see your happy face. I miss you very much.
Me too. I miss you too. This was super fun.
So fun. You're the best. Thank you for doing this always. You're such a gem, and I love you. And I come and see
Love you too.
And then
Yes,
whenever you guys
please.
want to visit us here, you're always welcome.
Would love it.
Give my
Mwah.
love to the family.
I will. You too.
Bye everybody. See you next week. Bye.